What's going on, my Huma 10 students? We are focusing on chapter 12 today. And just, the terminology is so, the jargon, a lot of it is hard to understand and pronounce the first time around. I think that, when we're talking about pregnancy and the cycle of pregnancy is a lot of things that I think we're lucky in a sense that we can look up online. We can look at videos on YouTube in terms of contraception, right? But spend some time just trying to understand it the first time. Okay. This is for my Huma 10 students. This is chapter 12. Okay. Conception, pregnancy, and childbirth. Let's go ahead and get into it. So the main topics are fertilization and fetal development, pregnancy, infertility, the process of giving birth, postpartum, and beyond. Okay. And we talked about this in chapter 3 when we talked about the female anatomy. But once the oocyte or the ovum of an unfertilized egg is released from the ovary, it drifts into the fallopian tube where it may be fertilized if live sperm are present. So if the pregnancy proceeds without interruption, the birth will occur in approximately 266 days. Sometimes that baby may come a little early, right, which we call premature baby. Sometimes that baby will come late after the 266 days. But in the fertilization process, that oocyte remains viable for 12 to 24 hours after ovulation. And most sperm are viable for 12 to 48 hours. So that's a half a day to 2 days, right? That's why birth control, contraception is very important if you are not trying to get pregnant. So for fertilization to occur, intercourse must take place within 5 days before and 1 day after ovulation. Sperm that reaches the oocyte are not yet capable of getting through its outer layers. So capacitation, right, is the process by which sperm membranes become fragile enough to release necessary enzymes from their acrosomes, right? So the membrane of the sperm cell contains a chemical that helps adhere to and penetrate the egg's outer layer. So that sperm has help, right? Right? Okay, so fertilization process continued. So once a single sperm is inside the oocyte, cytoplasm or a chemical reaction occurs that blocks any other sperm, right? Because people often ask, well, why can't a woman, get pregnant multiple times with ejaculation? Well, this is why. The oocyte cytoplasm, right? It closes off, from other sperm to enter. So next, the oocyte becomes a mature ovum by forming the ovum nucleus. The ovum and sperm release their chromosomes, which combine to form the diploid zygote containing 23 pairs of chromosomes, right? So each parent contributes one chromosome to each pair, usually X and X, right? It's not until that chromosome or that Y chromosome comes through, which will allow the feces to develop into a boy, right? So blastocyst, this is the zygote after a series of divisions over the course of 45 days. Implantation, the process of about 1 week in which the blastocyst arrives in the uterine cavity, where it floats for a day or two before implanting in the soft blood-rich uterine lining. Blastocyst, or preembryo, rapidly grows into an embryo, which will in turn be referred to as a fetus after the 8th week of pregnancy, right? These are all the steps, right? So figure 1 shows ovulation, fertilization, and the development of blastocyst, right? So you want to pause the video, take time, take notes, reflect. Development of conceptus, right? During the first 2 to 3 weeks of development, the embryonic membranes are formed. The amniotic sac, or the bag of water, is a sac that holds the embryo and later the fetus. So the amniotic sac has 2 membranes. Amnion is the inner membrane, which holds the amniotic fluid and the fetus, right? Chorion, or the outer membrane, which encloses the embryo and contributes to the development of the placenta, right? The placenta is an organ that connects the developing fetus to the uterine walls to provide nutrients and oxygen via the mother's bloodstream, which also removing waste products from the fetus blood. This grows larger as the fetus grows. So attached to the wall, the uterus and to the fetus umbilical cord, which connects the placenta and the fetus, right? And the fetus, that is the baby, right? And the placenta is connected to the mother, and this is how the baby is nourished. So serves as a biochemical barrier, but certain prescriptions and other drugs, tobacco, alcohol, and some viruses do cross it and can harm the fetus. That's why they tell you don't drink, don't smoke, don't do any kind of drugs when you are pregnant. Right. So figure two, this is a breakdown of the fetus in the uterus and the cross section of the placenta. Right. So the placenta is the organ of exchange between the mother and the fetus. Right. Nutrients and oxygen pass from the mother to the fetus, and waste products pass from the fetus to the mother via blood vessels within the umbilical cord. So pause the video, take time, take notes, and reflect on the diagram. So development of conceptus, right? First body segments and the brain begin to form during the third week. During the fourth week, digestive and circulatory systems, then the spinal cord and the nervous system, right? The fifth week is formation of arms and the legs. The sixth week is formation of the eyes and the ears, right? During the seventh week in conceptus, the reproductive organs begin to differentiate. During the eighth week, fetus is about the size of a thumb, right? It is a slow process. But by the 12th week, the arms, hands, big fingers, legs, feet, toes are almost fully developed. During the 15th week, the strong heartbeat is detected, some digestive functioning, and the fetus is covered with a fine downy hair called lanugo, right? Figure 3 shows the growth of an embryo and the fetus. In this drawing, the actual sizes of the developing embryo and fetus are shown from conception through the first 15 weeks. By 5 months, the fetus is 10 to 12 inches long. At 7 months, it's 13 to 17 inches long, depending on the size of the baby. It weighs about 3 pounds and is likely viable, capable of surviving outside of the womb, right? Full-term pregnancy lasts about 40 weeks. The fetus will be about 20 inches long and weigh about 7 pounds, depending on the baby's weight, right? So although 37 weeks is considered full term, even a few weeks early can mean greater risk of health problems. So you want the baby, you want the delivery to happen at full term, right? Preconception health. The health of the parents before conception and the woman in early pregnancy affects the health of the fetus. Preconception health. Health of individuals during the reproductive years to protect the health of a future baby. Prenatal. That's why prenatal care is so important. This is recommended after a woman becomes pregnant. It involves monitoring the baby's development and the mother's health. So lifestyle choices such as physical activity can influence the outcomes of pregnancy. In terms of pregnancy detection, the chemical test can usually determine pregnancy about 1 week after a missed or a spotty menstrual period. These are designed to detect the presence of human chorionic or gonadotropin, also known as HCG, which is produced immediately after a fertilized egg attaches to the uterus. So the two types are urine and blood. So the blood test can determine the baby's sex at 7 to 20 weeks. Which we refer to as Hagar sign, is a softening of the uterus just above the cervix, which can be felt during a vaginal examination, right? Adjustment and psychological changes in women's during pregnancy. So women's early responses vary dramatically. Feelings may be ambivalent and will probably change over the course of a pregnancy. Couples' relationship is likely to undergo changes, right? Pregnant women's relationship with her own mother also undergoes changes, right? Table 1 shows the principal task of expectant parents, the mothers and the fathers, and what they have to do from development of an emotional attachment to the fetus and the father's acceptance of the pregnancy and attachment to the fetus. All the way on down, you want to take time, read this and reflect, right? All the way on down to the evaluation of practical and financial responsibilities where both mothers and fathers have to do. Adjustment and psychological changes in women during pregnancy. So during the first trimester, 3 months may be physically difficult. So approximately 70 to 80% of women experience morning sickness, including nausea and fatigue. The second trimester, most nausea and fatigue disappear, and the woman can feel the fetus move. She may look and feel radiant, though she may also be concerned about her increasing size. During the third trimester, challenges increase, right? Edema is water retention. So pressure on internal organs such as lungs and bladder and the physical abilities become limited. Figure 4 shows the mother and the fetus in the third trimester of pregnancy. The expanding uterus affects the mother's internal organs, causing feelings of pressure and possible discomfort. Complications of pregnancy and dangers to the fetus. Teratogens, substances, or other factors that cause defects in developing embryos and fetuses. Greatest vulnerability during the embryonic stage, weeks 1 to 7, and early fetal development, the first trimester. Birth defects, structural changes present at birth that can affect almost any part or parts of the baby's body. Complications of pregnancy and dangers to the fetus is fetal alcohol exposure, and one of the leading preventable causes of physical and behavioral and intellectual disability. There is no known safe amount of alcohol consumption for a woman during pregnancy or when trying to get pregnant. So fetal alcohol spectrum disorder, or FASD, is the umbrella term for a group of conditions with symptoms including hyperactivity, poor language skills, concentration, and poor math skills. Fetal alcohol syndrome, or FAS, abnormal facial features, growth problems, and central nervous system problems. Alcohol-related neurodevelopment disorder, or ARND, is intellectual, behavioral, and learning problems. Alcohol-related birth defects, physical problems. Complications of pregnancy and dangers to the fetus. Several other factors represent significant threats: chemical and environmental pollutants, tobacco use, marijuana use, other drugs including opiates and common prescription and over-the-counter medication, infectious diseases such as Zika, sexually transmitted infections, maternal obesity, pregnancy after the age of 35. So if you have the ability to limit some of these dangers, like the tobacco, marijuana, over-the-counter, alcohol, right? Do it. Do it for the health of your baby, right? Table 2 shows the risk of having a baby with Down syndrome by mother's age, right? It goes up, right? Every 5 years, that risk goes up. One risk associated with later age at pregnancy is the chromosomal abnormality called Down syndrome. All right, complications of pregnancy and dangers to the fetus. So ectopic pregnancy is the fertilized egg grows outside the uterus, usually in a fallopian tube. So this risk may be increased by PID. Right, previous ectopic pregnancy treatment with assisted reproductive technology and endometriosis, growth of tissue outside the uterus, gestational hypertension or pregnancy-induced hypertension, high blood pressure, and edema, along with protein in the urine, if untreated, can progress to maternal convulsions and a stroke. Right, preterm births that can take place prior to 37 weeks of gestation. About 10% of all pregnancies in the United States result in preterm, right? Preemies, right? Premature births, or one consequences is low birth weight in infants. Those who weigh less than 5.5 pounds at birth. About 35% of infant deaths in the U.S. are associated with preterm birth related causes, right? So prenatal care is an extremely important means of preventing prematurity. Genetic carrier screening. So prenatal tests are available to address concerns about birth defects. Carrier screening tests, which can show if a person carries a gene for inherited disorders such as cystic fibrosis. Screening for risk of a birth defect such as the neural tube defect. Diagnostic tests identify certain fetal abnormalities. Chronic villus sampling cells from the placenta. Amniocentesis, withdrawal of amniotic fluid, Neural tube defect screening performed on the mother's blood to measure the level of alpha fetal protein, right? Figure 5 shows diagnosing the fetal's abnormalities via amniocentesis and chorionic villus sampling. Pause the video. Pregnancy loss. So death of a fetus before 20 weeks is called early pregnancy loss. Miscarriage, the spontaneous expulsion of the fetus. Stillbirth, death of a baby before or during delivery. Infant mortality rate, number of deaths of infants before their first birthday, often used as a measure of a nation's well-being. Sudden infant death syndrome, or SIDS, an infant of less than 1 year dies of an unexplained cause. Feelings of shock and grief felt by individuals whose child dies before or during birth can be difficult for others to understand. Infertility issues or impaired fecundity, right? The failure to establish a pregnancy after 12 months of regular unprotected sexual intercourse, okay? So if the problem is 35 or older, 6 months, right? So equally likely to occur in both men and women. So the most common risk factors are advancing age, overweight or obesity, excessive alcohol use, smoking, excessive stress. Fertility problems can cause an emotional crisis for many couples. Coming to a joint decision about goals, acceptable therapies, and endpoint for therapy is important. All right, female infertility. About 10% of U.S. women aged 15 to 44 have difficulty getting pregnant or carrying a pregnancy to term. Right, age is the best predictor, but the other factors are smoking, alcohol use, poor diet, excessive athletic training, stress, being overweight or underweight, sexually transmitted infections, health problems that cause hormonal changes, all can lead to female infertility. Right, and this table 3 is a percentage of women aged 15 to 49 who are infertile by current age. And this study was done between 2015 and 2017. Take notes and reflect. Male infertility, or sperm, can be altered by overall health and lifestyle, right? So having varicose veins on the testicle or low sperm count, decreased sperm motility, right? And poor sperm morphology, right? The mishap in sperm can often interfere. Other factors include age, alcohol, tobacco, drug use, and STIs. Also health problems such as the mumps. Infertility treatment. So fertility problems are almost always physical, and treatment can be emotional and financially costly, right? It costs a lot of money to get treatment. There are many ways that fertility can be enhanced. They have fertility clinics all over the world now. The timing of coitus. Are you having coitus during the ovulation periods? Having them during the ovulation periods is obviously going to enhance the percentage of being pregnant, right? The chances of being pregnant. So change from tight to boxer type underwear for men. Many couples, however, may seek physical intervention to diagnose and treat infertility. So prior to investing in treatment options, preventative steps are advised, such as avoiding alcohol, tobacco, drugs, and exercising, and eating a healthy diet that consists of vegetables and fruits. Right. Techniques and technologies to promote conceptions: fertility medication, surgery, artificial insemination, all right, or AI, introducing sperm into the woman's uterus, assisted reproductive technology, all treatments in which both eggs and sperm are handled, or IVF, right? In vitro fertilization, where eggs are fertilized in the laboratory. So intracytoplasmic sperm injection is a single sperm is injected into the mature egg, right? So in terms of the assisted reproductive technology, this or art is associated with high rates of multiple births. Other options are surrogate motherhood. A surrogate mother becomes pregnant with the man's sperm in her own egg. Gestational carrier. A woman's own egg fertilized by a man's sperm is placed inside the carrier's uterus. Age remains an important factor still. So gender selection, a technology that allows couples to choose whether to have a boy or a girl. So gender selection. Right, giving birth. During the later months of pregnancy, the placenta produces the hormone relaxin, which increases flexibility in the ligaments and joints of the pelvic area. Right, the Braxton Hicks contractions are strong uterine contractions that exercise the uterus preparing for labor. So, labor and delivery. Labor can generally be divided into three stages. True labor begins when the uterine contractions are regularly spaced, right? Effacement or the thinning and dilation, the gradual opening of the cervix occurs when the fetus presents a part of itself into the vagina, generally with 2 to 24 hours. So the first stage is expulsion of the mucus plug that has blocked the cervix. Transition, when contractions, come more quickly and are more intense, and the baby's head enters the birth canal, which is called crowning. Second, second stage, from when the baby's head moves into the birth canal to when the baby is born. When the baby's head emerges and does not slip back in, this is known as crowning. Right? So baby will still be attached to the umbilical cord connected to the mother. It's not cut until it stops pulsating. The vernix, or the waxy substance that covers the baby. The third stage is the afterbirth. The uterus continues to contract, expelling the placenta, leaving it behind, the remaining section of the umbilical cord, and the fetal membranes. Attendants will assess the condition of the neonate or newborn, rating heart rate, respiration, skin color, reflexes, and muscle tone using a system called APGAR score, right? So you'll hear APGAR score during labor and delivery, right? What is the mother's APGAR score, right? Mother will continue to feel contractions and will have a bloody discharge called the lochia. Right. Figure 6 shows the birth process, and in the birth stage, the cervix begins to effuse, to thin out or dilate. And B, the transition stage, the cervix dilates from 8 to 10 centimeters. C, in the second stage, the infant is delivered. And D, in the third stage, the afterbirth placenta is delivered. Take notes and reflect. Choices in childbirth. So traditional, sometimes impersonal care is provided. In most hospital births, many people see a need for family-centered childbirth, and partners and others often participate today. Some sort of pain relief is often administered, right? Analgesics provide pain relief. Aesthetics block all feelings. And anesthetics provide all feelings. Epidural is a regional anesthesia administered through a tiny catheter placed in the woman's lower back. Episiotomy, an incision that enlarges the vagina opening by cutting through the perineum, right? Labor induction, use of medication or other methods to bring on or induce labor. So the best labor plan is to wait for the delivery to begin on its own. Cesarean section, or a C-section, delivered through an incision into the mother's abdominal wall and uterus. I was born through a C-section or cesarean section, right? Many medical reasons, including abnormalities of the placenta and umbilical cord, or prolonged or ineffective labor, right? Subsequent deliveries need to be C-sections just because the previous one was. So I was the firstborn of my mother, and then my sister came via C-section as well, because it was already done on my mother for me, right? So Americans are increasingly choosing from among several alternatives to the hospital birth: prepared childbirth based on learning about conditioned reflexes with breathing and other exercises, birthing rooms and centers, home birth, midwives who may be registered nurses, and doulas who offer emotional support and help to manage pain, right? Breastfeeding. Breast milk is the ideal food for babies. It contains the right amount of nutrients, boosts the baby's immune system, and is the best way to keep the baby healthy. Lactation, the production of milk, begins about 3 days after childbirth. Before lactation, a yellowish liquid called colostrum is secreted by the nipple to nourish the newborn before the mother's milk comes in. And colostrum is high in protein and antibodies that help protect the baby. Postpartum and beyond. Postpartum The postpartum period is 3 months or so following childbirth. Time of physical stabilization and emotional adjustment. So, Family and Medical Leave Act assures eligible employees up to 12 months of unpaid child protected leave for specified family and medical reasons, with continuation of group health insurance. So many mothers experience the baby blues with irregular sleep patterns and feelings of isolation from their familiar world. Fathers' involvement in the children's lives has been shown to have positive effect on their well-being. Postpartum depression, the moderate to severe depression in a woman after she has given birth. Thought to be related to hormonal changes brought on by sleep deprivation, weaning, and the resumption of a menstrual cycle. Anxiety disorders may also arise or reoccur. Postpartum psychosis, more serious than postpartum depression, thought to be exclusively biologically based and related to hormonal change. So, our final thoughts, we talked about fertilization and fetal development, pregnancy, infertility. We also talked about giving birth, postpartum, and beyond. As always, feel free to go back and review your notes, review some of the things that may have come up. And oftentimes, if a certain vocabulary word or a certain part of the child birthing process, we could probably find a YouTube clip that shows a visual. So if you are anything visual, if you're a visual learner like myself, sometimes it helps to see that video on the embryonic fluids or any of the things that we learned about. You could take a deeper dive. So for those of you that are going to be studying human biology or anatomy and physiology, we kind of scratched the surface. Those of you that are going to become doctors or nurses, you're going to take a much deeper dive. But if this is your introductory into childbirth, then I'm happy to be on that journey. All right. This is Professor and Counselor Rob Alexander.